Okay, very cool. So you said you were in Denver, Colorado for 11 years, right? So you did 3 years of private practice and
Mm-hmm.
had your skill obviously pretty
Mm-hmm.
polished. And then what happened? Then you joined Kaiser Permanente. So now
Yes.
you're uh, go ahead.
Mm-hmm. So I was in private practice, and in Denver, it's a little bit of a crazy climate for OBGYNs, and I felt like Kaiser was providing the best care for women in the
Mhm.
city. So I took a chance and got a job there. And yeah, it's been a great place to work. And over the last 11 years since I've been there, um, I've really found myself in the niche of chronic pelvic pain and endometriosis. And it kind of came to me, I wouldn't say by accident, but I think there's always a plan for everything. But it came to me in a situation where I had had my second child, and I felt like the demands of call surgery in office were just a little bit too chaotic for my two young kids. And so I actually moved for a year into a temporary, like just office based practice with Kaiser. And in that year, I was just struck by the amount of chronic pelvic pain and endometriosis that I was seeing day after day after day after day. And I was seeing it before too, but I was also seeing a variety of other things. And I kind of felt like these people were at a loss as I would see them in the office and just kind of working through their pain with them. And a lot of them needed surgery. And so we really only had one person at the time at our organization that was doing the chronic pelvic pain and endometriosis excisions, and she was overwhelmed by the volume. And so after that year, I kind of felt like I really could help these women by changing what I'm doing. And so I decided then, hey, okay, I'm not going to do office based practice alone anymore. I want to go back into like the general OBGYN realm, and I want to continue to take care of these women with endometriosis and get back into surgery. And so then I just started going to like IPPS, different pelvic pain conferences, learning about endometriosis, learning from this other woman at our organization who was doing similar type things and co-managing patients with her. And then it kind of just took off from there. So there's no shortage of people with endometriosis. Um, and I feel like with the particular insurance carrier that I work for, it feels like it's even a greater um, need. So we see a lot of chronic pelvic pain and
Mhm.
endometriosis, and just there's just not a lot of, I mean, OBGYNs and doctors that have an interest. And so I felt like, okay, I have an interest. Let's get more educated. Let's get additional surgical training. Let's learn from these people so we can help these patients instead of just like, okay, here's birth control and follow up with me in 3 months, or you know what I mean? So I was like, there's something has to be done for these people. So then I've been learning the surgical skills, and so I started back doing the surgery probably, let's see, my son's 8, so what, about 8 years ago. And currently I do straight stick laparoscopy for endometriosis excisions, but I'm looking at making a big change there. Um, so I've
Are
still
you
got about
taking? Are you
15
taking?
years.
Go ahead. Sorry.
I've still got about 15 to 20 years left in my career. And so I think to be of like best possible service to this population, and this group of people that I need to keep evolving. I need to probably move to the robot, learn that skill set, and it should be hopefully a pretty easy transition. But um, it's a field that's like rapidly changing, right? So you just like have to keep
Yeah. Oh my God.
moving and keep evolving. And like I just feel like the technology might be out there to take care for these women a little bit better.
Yeah. Yeah, it's like we never knew this exists, and now everyone knows. And now, because everyone is focusing on it, all these innovations and new learning happens every month. Every you watch these surgery videos like every month. Even the surgeons that you think are the best, next month they put a video. They themselves are impressed by it, and then they learn new things, obviously. So before
Yep.
we go too deep, I want to call your name and what's written on your Instagram about you, so if someone is listening knows who we are
Sure.
talking to. Dr. Jill Ingenito, I hope I
Hmm.
said it the right way,
Yep.
and pelvic pain physician, an endometriosis excision surgeon, an OB-GYN in Kaiser Permanente in Denver, Colorado. Was
Hmm.
that correct?
You got it all.
Awesome. Cool. All right. So we jump into the most exciting part of the conversation that I'm very personally passionate about, and our platform, iCare is about this. So let's have. So you started your Instagram campaign in some sense not too long ago, but you have
Right.
crushed it.
Oh
It
my gosh.
seems
Really too kind.
no,
It's,
it seems you are hitting the right spot. You have learned and you understood people because there is some chemistry that has attracted all these people, and you have created a lot of excitement and also ambition. Like you get a lot into a lot of ambitious conversation and discussions and debates.
yeah.
Yeah. So now we know about how you moved into pelvic pain. We're going to go back to it, but I want to also learn about this aspect of you because there's probably a combination of topics to talk about moving forward.
Yeah. Yeah. So I think I put it out maybe January of 2024. And I was like, I don't know. Not sure. Not sure about this. And I just kind of stalked other people doing pelvic pain on Instagram and saw what they were doing. And I was like, I just don't know. And I think I had come back from a vacation with my family in March, and one of my first days back in the office, and I see a wide range of people on the endometriosis journey, right? Like some are veterans, and other people are like, what's endometriosis? And so it's you never quite know what your audience is. So I always try to get a feel of like what's going on in the room. But I think I had someone who basically brought me a TikTok, and it was something about an ablation or an excision, and the information wasn't quite correct. And I was just like, oh my gosh, I feel like I could at least put this message out there in a different way, in a way that's maybe not being done. And what I mean by that is like they're right, there's just like the good information, the bad information. That is what it is. But I'm also coming from the perspective of I manage chronic pelvic pain and other chronic pelvic conditions, but I also have like a very specific niche, endometriosis and endometriosis excision. And so I can kind of see like not only just like the benefits of excision, but all different types of therapies and like what patients go through, right? So I felt like I might have a different take on it. And, for a while, people were like, you should do social media. You should do this. I'm like, oh, I don't know. So I was like, I'll just give it a try. I mean, what's the worst that could possibly happen? It's a flop. I don't know. So yeah, just decided to do it. And it's been interesting, learning along the way what you learn. And I mean, I've even learned stuff in the last, like, I would say 10 months, just even from the community of endometriosis that's online here and on TikTok. And I try to keep up with as much of it as I can. I didn't realize how much work it was going to be. Um, but even if someone had told me that, I probably still would have done it. So, I think it's just like keeping it under, you know, still trying to keep up with my like clinical duties plus my family duties plus taking care of myself plus, you know what I mean, not spending too much time on social media. So yeah, but I've learned a ton actually just in the short time of doing it from the community and kind of okay, you got this totally wrong here. You might want to take a step back and look at this. And I've met people through this social media that really have been so kind to me and have reached out to me in different aspects of this journey. So, and I actually am looking forward to meeting more of them in the future. So,
That's amazing. In my opinion, the biggest problem currently with all this social media is disinformation and misinformation. And for a long time, I mean, there is a long story why it was the case. Physicians won't come to Instagram or social media because there was this code of conduct that they would like probably try to encourage physicians not to be on social media
mhm,
that much. But then on the other side, the whole endometriosis situation was like in a really like terrible situation. Patients were terrorized and traumatized. So they started this whole campaign on
Mhm.
social media, but they are not like professionals. Obviously, they learn something about their body, their disease. Sometimes they cannot filter out what's the disinformation and misinformation, what's the correct information. Then they will echo that. Then there was this gap that we didn't have any experts talking about endometriosis and the right thing, but then we had all this misinformation circling around. So that's why I think what you did, and I completely understand. I personally have learned so much, and I'm still learning from patients, from advocates, from other doctors. So it's great. It's a beautiful thing. You learn in your process of evolving, but
Totally.
things what you like what you're doing, I think it's really important, like talking about the facts and things. And I really enjoy watching. I'll always follow you and
Okay. You're so
things that
kind.
you say.
And I will say, like, that still exists. I mean, especially a lot of people, when I was kind of telling them that I was going to do this, that I work with, and other colleagues that I work with outside of my organization, they were like, "Well, you can't do that. You can't do that." And people still report me to HR. And I'm not kidding. I still, I have talked to HR a number of times. Um, they'll call me in the middle of a surgery day, and I think I had reposted someone else's video. I reposted someone else's surgical video. Actually, a patient posted about her surgery, and I reposted it. And someone that I work with, I don't know who, but they got a hold of it and told HR that I was posting patients' videos of people I was operating on. It was somebody else's. Anyways, so I've become very familiar with the lovely team that we have here in HR. And obviously, I don't want to like put anybody at risk or anything like that, but I still feel like the eyes are on me, that this isn't, I feel like there really isn't something you should do. Whenever I tell people, like, Kaiser, they let you do that? Like, so they actually just really supportive. But you do get a lot of people that are like, you shouldn't be doing this.
Yeah, it's against, I mean, in general, like anything social or marketing. I'm not saying you're marketing, but these platforms are made for marketing or like making connections. It
Yeah. So that's interesting too, because I'm not actually marketing. You know what I mean? I felt like there was a lot of people are marketing their surgical services, and they by far and away should, because people do not know where to go, what to get done. So I totally appreciate those accounts, and like I've learned a ton from those accounts. But I think that's actually been a really tough thing for me, is people say, "Oh, I want to come see you. I want to come see you." And then they call and they're like, "Wait, what? This is where she works. I have this insurance. Like, I can't see her." Like, I'm actually just trying to get the awareness out there, get the medical information out there, like
Mhm.
do it in kind of a funny way sometimes not. So that's been interesting. That's been very interesting for me to try and navigate.
Where do you want to get with this? Because I think that's the unique part about you. So you work for this organization. They do probably billions of dollars of marketing per year to just make a brand and make patients come to them, and they have this health network. So they have a pretty comprehensive end-to-end organization. They are the health plan, they are the provider. So they can bring as many patients as they want to, and do. Then you are an employee of this organization, so you never have to worry about having patients, because they are taking care of it and your patients are taking care of it. Word of mouth gets out, but then you start this
Thing.
is, I mean, this takes some extra energy, some extra, there is some extra energy and passion there. Where do you want to get with this? Like, what's the what's the goal here? What's the end goal?
People have been asking me that since I started this. And I felt like I just kind of was like, I, I mean, I started this because I was like, I just need to get some information out there. Like, this is crazy what I'm hearing from patients and what they're seeing on Instagram. I was just like, I'm just putting the information out there. Here's what I got. Um, a lot of people in the beginning were like, well, what's your goal? What are you going to do? Like, what are you going to do with this? Are you going to just do social media? Are you going to move on? And I have been patient. I've prayed a lot about this. I am trying to be patient, and I feel like God is evolving a plan for me and kind of leading me. And especially starting the new year, I was like, okay, I have my New Year's resolution. What the heck am I going to do with this? And I just haven't had a clear path. But I think over at least last month for sure, it definitely putting some certain things out there for me to be like, okay, if you really want to do this, you really want to take care of this population and you're passionate about this, this might be the direction you're going to go in. So, and that is the nice thing for me. It's like, that's why I love Kaiser for many reasons. I love working there, but like, I don't have to recruit patients. Like,
Mhm.
I don't, it's like, that's contagious. Is endometriosis
Mhm.
contagious? I don't know.
Mhm.
Like, we always kind of joke around, like, our insurance payer, like, is that an independent risk factor for endometriosis? I honestly wonder. So it just, there's no shortage of patients. And it also, I really like it because I'm not biased in terms of what I offer you. Okay. I'm just going to tell you, like, you can go down this path or you can do it on this path. If you don't want to have surgery, here's what we can do. If you want to have surgery, here's what we can do. I'm not getting paid
Mhm.
differently, right? I just show
Mhm.
up the hours
Mhm.
that I work, the hours I get paid for. We're hourly employees.
Mhm.
So I don't, it's so nice because I just don't have this pressure of like, oh my gosh, I have to
Mhm.
do this big excision for this person.
Mhm.
It doesn't, I just, if that's what you want, that's what we do. You don't want that? Okay, we do this, and I get paid the same. So that's like a really, really, um, that's like a really nice benefit of working in this setting. And there's also some drawbacks too, but I just want to offer people like the best care possible, give them the
Mhm.
best information possible. And that's the thing with endometriosis and chronic pain in general is like what's right for one person ain't right for the
Mhm.
other person.
Mhm.
Right.
Mhm.
And I always try to like find out like, okay, how far along in this journey are you on in your
Mhm.
care? How many doctors have you seen? Oh, you're the first person or you're the 15th
Mhm.
person, like, okay, you kind of know what this is
Mhm.
and what you want to do and
Mhm.
how you want to navigate it. Whereas other people are like, I don't know. This is the first I heard of endometriosis. What should I do?
Mhm.
So, yeah, I think I honestly don't know the answer to that question
Mhm.
today, um, on February 19th, 2025, but I think I'm going to figure out the answer to
Mhm.
that question. And I think in the meantime, I'm just trying to take best care
Mhm.
of my patients as possible
Mhm.
and keep putting that information out there. Um, and I'm making some connections coming up here. And so that might kind of
Mhm.
make a difference in terms of what I plan to do. But like, it's kind of silly. Like, I didn't really have a plan going into
Mhm.
this. I was just like, okay, that video is dumb. I'm going to read like this video. I can do this
Mhm.
better. Here's what you need to know. So
I
I don't know. I
think
wish I had a really great answer for you. Like, here was my business plan and here are my goals. But
it's evolving. I'm pretty sure the more you get this question, the more you think about, and then opportunities can show themselves. Maybe there's an opportunity that you can have higher influence or more impact for patients or for providers, though.
right.
So as long as you're growing and you're having an audience and you're building that audience, I think you can always think about what's the next move. So yeah,
Yeah.
I understand if you don't have any solid next step, but obviously I understand that it's an evolving plan.
And it's so with me, the thing about it is actually like I feel like I've always had a plan. I have a plan for everything. Like I have a plan A and a plan B. And I had no plan here.
First time.
Well, I
Good
mean,
time.
having kids is kind of a journey and having no plan, but I feel like I just didn't have a plan here.
Mm,
So we'll see where it takes me.
yeah. So back to you were talking about how you got into endometriosis care, started from this outpatient setting, which really was something new to me. I'm going to think about what you just said, and then you got these patients, and so it seems that in your philosophy of care, I was reading on your profile that you think about endometriosis and basically patients as a whole person, like you're not treating a problem or you're not treating a disease. This is an individual, this is a human, so which has been something that I am like really a big fan of, this type of thinking, like holistic approach, bring all the pieces together. This is an individual that needs to be taken care of. It's not. So can you? But so that's I'm a fan of this school of thought. So you got
Right.
me there. Can you open that up or for us? Like, how does this work in your practice for endometriosis patients? How do you do this for your
Okay.
patients?
So, I mean, when I started like just doing the outpatient clinical
Mhm.
stuff, I really got to know these people
Mhm.
because the majority of them were just waiting for, right, their surgical
Mhm.
excision. And
Mhm.
at the
Mhm.
time, I was like, I know how to do it, but I'm just not doing enough of these. I don't do
Mhm.
this all the time. Like, I need a 9 to 5 right now. Okay. I have two little kids. how's it works. I just need to do this. So I felt like I really got to know them and really got to know how to manage chronic pelvic pain outside of the operating room, right? And a lot of these people, they have like complex needs, right? There's just, it's not just their pelvic pain, but also like, how is it affecting, like, okay, what you do day to day? How's it affecting your marriage, or how's it affecting your relationship? What are the different needs that I was trying to optimize as much as I possibly could for these people outside of the OR. Like, what skills can we bring to this, and how can we treat, the mental aspect of it and the psychological aspect of it? And okay, what about the muscles and the nerves and the ligaments? Like, what other organ systems are being affected by this? And so I felt like I was kind of like forced almost to try to learn how to approach this without the tool, because they would wait months. I mean, even in our organization, they would wait 6 months just to see this one specific person who could excise it. And so I've picked up, I mean, there's a lot of themes, right? There's a lot of themes, and you start to pick up on these themes with these patients with chronic pelvic pain and endometriosis. And I know that if I just go in there offering like one specific thing, like I've missed the mark, right? And then they'll send me an email, right? A couple months or a month later, and be like, you missed all of this other stuff. Okay. Like, what about this? What about this? What about this? What about this? So, um, I think the community just like really pushed me to, hey, you got to look at this. Tell me how I can help myself outside of excision, and tell me what are the tools that I can use. So, and I do find, like when people are just really focused on, okay, I want the excision, I want the surgery. I'm like, that's fine. Like, here's what else I can offer you. But like, if we don't address these other components, we're probably missing out on some really good opportunities. So, some people like are totally in tune to that to start with. Okay, I'm interested in this whole kind of picture, and then other people are like, I want the surgery, and then you can tell, then I can hear everything else you have to say. I also live in a community, so I don't know much about Denver, Colorado, but it's very, I won't say granola, but I see patients from all over the metro, and this particular area of the country, I feel like is very in tune to their health, and they should be, but they're looking for, what supplements, what anti-inflammatory, should I do this, should I go to pelvic floor peace, should I consider acupuncture, like all the different things. And so they're going to ask you, they're going to ask you, and then if you're like, I don't know. So I kind of had to take a step back, and I think it's just from a place where I started, like I started in an outpatient setting looking at this disease and like how I could optimize people's pain and how I could optimize their life without relying on just cutting it out. Now, cutting it out is very important. Don't want to like misstep on that. I also trained my med school training when I probably didn't even know what endometriosis was many, many years ago. It was as a DO. So I kind of came from, and that like you, like it always spoke to me. Like, this is a whole person. This is not just endometriosis. This is not just a disease. Like I kind of came from that wide range. And, as I've grown up, I've also seen like personal and my children, just different health conditions that have happened. And it goes so far reaching, like one of my kids has really severe ADHD, and like, it's not just, he doesn't sit down in school and listen, like it's so much more, with his whole health. And then also like with our family dynamic. So, as I've kind of moved through this and my own personal struggles with my health and having a condition, I don't have endometriosis, but I have a condition that was misdiagnosed for 20 years. So I kind of know, and again, probably just something God was like, you're going to need to go through this. You're going to be misdiagnosed for 20 years, and then someone will finally figure out what you've got. You can't like, and just how it affected me, how it affected like my medical school training, how it affected me as a resident, how it affected my life, all the things that were missed for many years. So, and then also just empathy towards those physicians, right? Forgiveness, forgiving yourself, being like, okay, um, I was told I had IBS, but turns out I had like really severe celiac, and I went in with a major complication of celiac. So, and just knowing how that like affected me as a whole person and affected my life. So interesting.
you know you I mean, there is this new movement. I think, you probably have seen that. And even like, even if someone needs excision, a lot of the excision surgeons now have realized excision, they call it, is a step one, and some of the best ones, they actually really advocate for multidisciplinary care. Like they have, if they are the best ones, they have a network of PTs and mental health specialists and dietitians and acupuncture. They have a network around them to send patients to them. So because obviously, I mean, everyone's dream is to have a pill to give to these patients and everything disappears, all the trauma, all the problems. But that's not the reality of this world. This is a disease, has impacted your health, has impacted your body for a long time or short time, depends, but mostly long times, 10 plus years. It's not going to go away overnight after one surgery or after one pill. It needs to be like process. And I call it a lifestyle disease, meaning it impacts your lifestyle and you have to modify your lifestyle. It doesn't mean you have to have a boring lifestyle, but you have to watch what you're eating, you have to exercise. Actually, it makes you a healthier, better person in some sense. You have to do meditation, you have to take care of your mental health, you have to eat better, you have to exercise. It's like, so that's, I think, I mean, even the best excision surgeons advocate for this whole person, in my opinion. They should, some of them they don't, but mostly they do. So
Yeah. No,
I love.
I think we're like, and you'll see, or you probably seen like before it was like, okay, I have an excision. And I get this question all the time. Okay, you did my excision. When should I do my next one? I'm like, okay, missed, missed. I missed the mark here. Didn't I didn't quite get it. So, the goal in my mind is that you have one good excision and then we manage the rest of it medically. And unless something comes up from an anatomical standpoint that we can't get on top of from outside of the OR, then yes, we go back. But I try to get people to say, okay, the next time I have surgery, it will be like a definitive, okay, I want you to go back and do a hysterectomy, take out the ovaries, do a second excision or something like that. But you don't ever need that if we can optimize other ways of managing the disease. And that's, the consults that I sometimes will get are new patients to Kaiser. They'll be like, well, they told me I'm going to need another excision. I'm like, well, what did they tell you? You need a pelvic floor PT because your muscle group is a disaster. So, it's like there is a lot of that out there. Like, okay, I'm going to have my excision. I need my next one. And I'm like, and then people come to see me and I'm like, how many have you had? And they get kind of stuck in this mode. And so I always try to set the groundwork. Like, this is where we are. This is the first step. Everything else needs to be managed medically. We need to keep you out of the operating room and keep you healthy. And these are all the tools in your toolbox that you're going to learn. And then, you shouldn't be having millions of excisions. Like, that's just like, what? And some people acknowledge, like, okay, well, I see people who are like, I had an ablation, or they just put a scope in and they said it was endo. Like, okay, you need an excision. But going in time after time after time, it scares me.
Yeah, I think this is also a mental capacity or mental strength game. I mean, in some sense, I mean that part that you mentioned, they go just to have an ablation or just laparoscopy for diagnosis. That's a different story. But if you find the right excision expert, which in my opinion there aren't enough of them in this country, unfortunately, maybe that's one part. But then when you find them and you do an excision, just be strong. Like anything in life, you need to be strong and focused and believe in yourself and your choices. You pick this right surgeon, did the surgery, you still have pain. Don't try to find someone to blame it on. There is a process. So I completely agree. I know a part of it comes from not having enough experts. People have gotten used to doubting the skill of the surgeon, even if they do the surgery with one of the best in the world.
Yeah.
That habit needs to go away because that's blocking their way. I think that's what you're saying.
Yes, that's exactly what I'm saying. And it's when that groundwork has been set, when it's like, okay, I doubt my surgeon, or I doubt what they did last time. It can be challenging. It
Hmm.
can be challenging to get people out of that. And it's like I'm always like trying not to be dismissive, or
Mhm.
I just but that is actually one of my biggest challenges, is getting people out of that thinking that this person did it. I need
Mhm.
you to do it. Okay, when am you doing my next one? And it's just like,
Exactly.
it's tough. That's tough. And that's where I'm like, take a step back. We got to
Mhm.
look at the whole picture here. Like me, myself, Dr. Ingenito, as a surgeon, is not going to be your savior. Like we need to take a step back. Like you and I as a team need to approach this, but relying only on surgical excision and expertise is really misguided.
Mhm. Yeah, I completely agree. So I want to learn more about your holistic approach. So just want to learn more about like the system that you're working. It's, I mean,
Mhm.
you're probably the first one in such a big system that I'm speaking with. So I'm asking a lot of questions out of personal curiosity, but
Yeah.
I can promise many people are curious about these questions. So you and this other physician are the ones who take care of endometriosis patients as a focus. I know you are doing probably some other you have to do because of your responsibility and contract and
Yeah.
you know, but so how the dynamic works? So do other doctors in your system or in the region try to send their patients to? Is that a culture that has been built already? How do
Culture
you?
that's been built. So it started with one person, and then I said, I'm interested. And I just kind of like did a lot of copy paste, to be completely honest. Like, this is what we're doing, like head to toe evaluation, International Pelvic Pain Society, intake questionnaire. And then, like, we have a pretty standard note, like, we're looking at inflammatory factors, right? Hormonal factors. Where does surgery play a role? What about the nerves? What about the muscles? We need to get this person to connect to PT. So, like, system based approached plan. And there's actually two other really good physicians in our organization who don't want to do as much complicated excision, but are really interested in the medical side of it too. And then we also have a chronic pelvic pain, or we have a chronic pain kind of team, which is psychiatry, psychology, pain, anesthesia. So there's like one group that can kind of step back and like say like, okay, here's all of the innovations for pain, and I feel like they're always changing. You know, like I have like a conference with them on someone and their pain, and then they're like, well, what did you know about this? I'm like, well, I talked to you last month and you didn't tell me about that. So they'll be like, you need to use this. Okay, got it. So I there's like a culture there where you can kind of lean on like these pain specialists, like, well, you haven't thought of this. This is, you know, this is outside the box. Here's what you can offer her. And things are changing. So this is what we've got going this month. And then, yeah, I mean, our organization is just so flooded that like, just to keep up with the regular OBGYNs, like they can't keep up with chronic pelvic pain management. Like they just don't. There's just not enough of us, you know, and there's a lot of us, but like you really need somebody who's doing it all the time, who's talking to these women, who's interested, who's passionate, who's doing the education, and then who is interested in surgical excision. So they were like, basically, they just send it to us. It's a chronic pelvic pain consult, and then we take those patients. And I mean, the unfortunate part that's happening is that you know, with one person, it would be like a 6 month wait, and now with two, four, like there's four of us now, it's still like I think I'm booking into May. And so it's just and that's as far as we have the schedule. So it's just like they're like I'm like these are the appointments. I don't even know what my schedule is. Um so yes, they've built a system for chronic pelvic pain, which I do feel like is unique. Um because I feel like other departments, large groups have like MIGs, um, but not necessarily like minimalist gynecologic surgeons, but they don't have a lot of other people like doing the holistic chronic pelvic pain and excision. So it's done in some places, and I do think like when patients leave our like when they change insurance or whatever, I send them to the university or I send them to Denver Health, and they have some good setups there too. So they exist. It's just as a patient, like it's tough to navigate. You know, it's tough to find people who do chronic pelvic pain management and who do excision. It's tough to have someone that looks at you as like a whole person as opposed to like, okay, you're the next excision, you know? So it's difficult. And it's like, well, okay, maybe we just need more mixed fellowships. But I don't think, I mean, I don't know all the ins and outs of every single mixed fellowship, but not all of them do like holistic chronic pelvic pain management. Like those fellows just have to learn how to excise good on the robot, manage complications, like
Mhm.
all the things. And they don't even not even doing all endometriosis, right? They're doing large uteruses and they're
Yeah.
doing, other complex diseases that exist in OBGYN. So yeah, we've kind of built this system, and that's the one thing that another thing I really like about it. And we can also lean on each other too. So that's a great thing where we can be like, hey, I don't think I'm thinking outside the box. Like I kind of feel like I'm up against a wall and I'm not getting anywhere and this person's still in pain. And then they can kind of say, oh, okay, you haven't thought of this, or I've just heard about this new modality.
That's very interesting. I really so, and despite all this patient volume, and like you have patients out until May, I read on your Kaiser profile that you still have to see OB patients.
I
is
haven't
that
updated my Kaiser profile in a very long time. And I actually was just driving in the car thinking about this the other day. I haven't updated it since I started there.
Mhm.
So the last time I wrote that was before I really did any of this, 11 years ago. And I'm actually hesitant to change it. I'm actually worried. I was driving. I was like, I need to write a new bio. And then I was like, if I write a new bio, I feel like the wait might get longer. Um, but I need to update my bio. But I don't, as this has evolved over the last several years, I don't see a lot of the other stuff. Like I'm like, I gotta see like even the patients that I see. Like, I'm like, I have to see them for follow up. Like, I can't see this 24-week return OB visit. Like that person, not that they're great, but I usually will make special preferences for my patients who get pregnant with endometriosis or chronic pelvic pain. I'm like, okay, I'll see her for her pregnancy. But aside from that, and I'm like, why do they, and it's just like there's no appointments, there's no access. So they're like, okay, I need to see her for my vaginitis. I'm like, okay. So I have very little of that. And the other person I work with has a very protected schedule. And I always toy with like whether or not I should protect my schedule and just see that. But I do think I learn some things from, and I got to tell you, the number of people that I pick up with endometriosis who are like coming in who are like, oh, I'm on the pill and I'm bleeding all the time. And then lo and behold, they're like, oh, well, I started on the pill because I have these horrific periods. And I'm like, oh, okay. You
Wow.
right? Or they're like, come to see me like, I was having sex last night and it was really painful. Okay. They're seeing me just to make sure like something wasn't damaged down there or they don't have an
Mhm.
infection, like an STD. And then lo and behold, it's like, oh no, I've had pain with sex for the last 20 years of my life.
Wow.
And I'm like, but you're here for a vaginal infection, So I've toyed with this idea that I just have protected chronic pain schedule, but I do
Mhm.
pick up a lot of places where endometriosis has been missed. And same thing with interstitial cystitis. I feel like I pick up a lot of that. Oh, I'm coming to see my OBGYN because I have a urinary tract infection. Oh, but my urine's negative. Can you just give me the antibiotics? Don't you want to know what's going on? Like, okay, turns out like you have bladder endo, right? Or
Wow.
you have interstitial cystitis, pelvic floor muscle dysfunction, and endometriosis. But like giving you the antibiotics that you said don't work. So I've had it enough times, right? And like again, I saw someone the other day. I was like, I literally sat in my office looking at my schedule. I'm like, what? Why? Why does this person get on my schedule? And I tell you, it was for like a bump, right? Like a
Mhm.
vulvar bump. And I'm like, okay, it's probably either this, or this, right? Okay, I'm going to do a herpes swab and I'm going to do this biopsy and X, Y, and Z. It was vulvar endometriosis. So that doesn't happen every day, right? But I literally was like sitting there and I'm just like, okay, God, I get it. Like, this is why
Wow.
you want me to keep doing other things because you're picking up endo or you're picking up other chronic pain conditions. It's not just I have a UTI or I
Mhm.
have pain with sex or I think I have herpes. Okay, you don't have herpes. You have a vulvar endometriosis. That's not the most common thing, but it's just the most pressing example that I had on my schedule. I was like, and we have a vulvar specialist. So I was actually just like sitting there, like, why is she not seeing the vulvar specialist? And the vulvar specialist has actually come to me, like, can you look at this? I'm like, that's endo. So I've seen two vulvar endos recently, which I is very rare.
That's very rare.
And I'm like, I don't know. I'm sure there's a third one coming.
So now I mean, I completely agree. like you working in other segments and seeing other patients, then like classic chronic pelvic pain helps you have a wider net to catch these patients who have and are presenting in different ways. And I think that's very smart. I have had people who wanted to launch a center for endometriosis. I suggested launch a center for pelvic pain because a lot of people don't even know that's endometriosis. But now you're putting some other thing in my head that even pelvic pain is not wide enough to catch all those patients.
Right. And like I very rarely, like maybe once a month, I'll do OB call. Um and I tell you, the last time I was there, horrible story, but this was someone that needed a C-section, and as I was doing her C-section, it was an emergency situation. I was like looking at behind her uterus, and I was like, "Do you have endo?" And she's like, "Oh yeah, I have stage 4 endo." And I'm like, I mean, honestly, I looked at it and I was like, "This is like bad endo."
Wow.
And so like I'm doing these things and I'm like looking and I'm like, okay, well, this is what the disease looks like in a C-section, right? And so that was also a key, like in my mind, okay, hey, when you're, and she's like, I really need to see someone about my endo. And I'm like, okay, great. When you're done with this, like come back and see me. And then, I had another unfortunate situation recently where someone had lost their baby, like a fetal demise with really bad endo. And then I kind of started to be like, gosh, is what are the pregnancy complications? What are the pregnancy implications? What's the implications of stillbirths and endometriosis? Like, is this a thing, or we just don't freaking know?
Mhm.
So I do find myself learning about a lot of things as I dibble dabble, like in various parts of OBGYN. So I've thought about like, okay, I'm just gonna go and forget all the rest of this crap. But I'm picking up things that I may otherwise not.
This is
So
this is very
it's weird.
interesting. So another question that I have now that you're why don't you just focus on like chronic care for endometriosis? Because that's crit- at this point, I mean, we know how few people can handle patients surgically, good do deliver good excision. We know how few. In my opinion, there are fewer person who can handle an endometriosis patient as a whole person, like hardcore. I mean, the ones that have a network, referral network. I mean, I respect them, but that's not a long-term management of a patient. Like that's a different story. You're just giving them resources because you believe in that.
Yeah.
But a physician with that philosophy to comes and say, okay, you want to do surgery, it doesn't matter to me. Everything you want to do is piece of a long-term plan.
Yeah.
Now, if you need a physician, a mastermind to walk you through the long-term plan, why not just do that? Why do you want to go learn robotics?
I
Because
don't know.
that.
This is I write about this stuff in my journal. Okay. I don't you're like, do you have a plan? I don't know. I don't know. Um I've thought about that avenue too. Like, should I just stay in this space? But I did feel like when I was in that space, like as when I was getting good at the end of that year where I just did office big practice and I was just doing chronic pelvic pain, clinical management, holistic management, I was also frustrated that I couldn't get my patients surgical excision. Like I remember being like, that's it. I've had it. Like I can't,
Hmm.
like email after email after email after email after a visit after visit after visit. When's my excision? When's my excision? And trying to optimize things. So I got really frustrated with the fact, now I'm still frustrated with the fact that my patients can't get in faster for surgery, but I got frustrated. So I don't know. Do I just live with that frustration? Do I just let the people that are doing it, already, like, why do I pick up that skill set? There's tons of people who are coming out with that MIGS training and MIGS fellowship, but I did, I, it does create a gap in continuity, even in my own institution where I was like, okay, go to this person and they'll do the excision. It creates a gap. Um, and I've had that gap kind of bite me in the butt once before, and that was a unique situation, but a lot of times people will come back to you after their excision and be like, well, what did you see? And I'll look at the pictures and like, I can see enough from the pictures, but like, I also don't know if I trust people to actually find it all, right? Like, there's like these pictures from like far back. And like even I operate with variety of partners and I'll be like, get the camera in there, like zoom way in. And I look and like, that's not endo. I'm like, well, it looks like it to me. And maybe I'm wrong, but we're gonna take out that spot. So it's like I don't, at least where I work, I don't feel like there's enough people who even know what it looks like. So like even if I just focus on the clinical management and I only have one person who's, the one or two people that I can rely on to really cut it out. And I mean, I am aggressive. Like I'm like, that's endo. If it looks anything like endo, I'm like, that's endo. Everything's endo. So I don't know. I felt like a little gap in the continuity, and then I just feel like there's not in my current situation, there's not enough people who are trained to see it with eyes. I mean, these are good OBGYNs and they're like, that's not it.
I know what you say. It's a conflicting situation. You are one of the rare resources there now. If you want to take yourself out of that and create something new, which we have probably even worse situation. But you
Yeah,
know,
I think you're right. I do think you're right. And that's where I'm struggling. That's why I've just kind of been like, I'm just going to sit on my hands, right? And I don't want to deal with the surgical complications. Like it's very risky. And I just had a horrible like one. And I'm like, I came home and I told my husband, I'm like, that's it, I'm done. Like I'm done. I don't want to do this anymore. I can do the same thing and just manage in the clinic, but I don't know. I don't know. I don't know, but I do see that gap. And the more I've done the social media thing, I've seen the gap, right? We have our excision specialist, okay, but then what else?
now if you think about like just I mean, even on social media or like in any organization, no one talks about what after surgery, right? It's
I
like
was just making a post about this before I got on with you.
really. Okay, I'm waiting for that. Tag me. I
Yeah,
want
I'll tag you.
you
It might be
know
bad, but that somebody actually posted in the comments, like, what do I do after my excision? So I was just posting about that.
someone needs to pick on this. It's not just about, I mean, obviously I'm talking to many people who are trying to deliver post surgical care. I mean, primary care physicians, nurse practitioners, some OB gyns, but someone needs to make sense of it, and someone needs to organize this whole thing, or some groups. There needs to be more structure over this. And
Which is why I've always said it's not just a mixed fellowship. We need a chronic pelvic pain fellowship with someone. Either that person can excise or they can't. We
yeah,
need someone trained in that area. And we've got the MIGS portion, but like we do need at least a year of chronic pelvic pain
mhm,
training, how to manage before and after excision, and what are the tools that patients
exactly.
can key in on before and after it. And I know maybe I should just do that.
Yeah, I
Less
mean,
risky.
and I know one other OB-GYN in general, like someone who hasn't done a MIGS, who is trying to do something similar. If you ever wanted, I can connect you to,
Yeah,
and
that would
maybe,
actually be great.
yeah, okay, I'll connect you to that person. Yeah, that's so in the OR now, although we are talking about getting you out of OR, maybe, but
Yeah.
back to the OR. So in Kaiser, can you tell us how does it look like? Do you have like, can you grab the colorectal or urologist? Can you bring them in the OR? Like, how does the system work?
Yep. So if I have, some complex disease where I feel like I don't feel confident taking the bowel down off of, some adhesions, then I can have our general surgeon kind of come in. Um, I'm getting better at my appendixes, but I still do rely on general surgery to kind of help me with those. But depending on who I'm operating with, sometimes I'll do it myself, and other times I'll have a general surgeon operate. But the funny thing is, like, they're all operating on the robot. So then they come into our cases and they're like,
Uh,
what are these chopsticks that you're using? Okay, you guys are still doing laparoscopy. And you would take out an appendix or but sometimes when you get into situations where you have to like oversew the bowel, right? A bowel lesion for endometriosis, they're Now you're asking a robotic surgeon who can sew sometimes faster than they can by hand to do it laparoscopically. Like it's just right. And so, and then you've got urologists, they're almost all on the robot. Like what? So yeah, I mean, that's the nice thing is we have them on hand, but you know, they can't, what I've unfortunately learned recently is they can't fix all things. But yes, we do have, um, you know, there's always someone on call for urology. There's always someone on call for general surgery. I think the diaphragmatic stuff. So if there's one person at Kaiser now that we have who's fantastic, who can do the thoracic endo. And so I don't have this person come in like that day because it's a whole other, you know, thing, but I take tons of pictures for him exactly how he wants it and then say, hey, if you're
Mhm.
still having symptoms of, and if your disease feels like thoracic or feels like diaphragmatic,
Mhm.
I can have this guy coordinate your surgery. So I try to optimize what I can and use our
Mhm.
colleagues. Um, but certainly certain things sometimes happen and it's outside of what we've got. And in those situations, surgically, you have to just stabilize and then wait for um, an additional expert to take care of it. So yes, we do have that. I have that benefit. Then they're right there on call.
I mean, that's great if you have that multidisciplinary team because, obviously it's a multi-systemic disease. So who knows? Who knows where it's going to be impacted until you do the assessment. And sometimes you go in and open the patient, then you realize. And recently there has been this new idea. I mean, not that recent, but pretty recently about the mapping of the disease. So a lot
Yes.
of people go in knowing where they are expecting the disease to be. So
Yeah, no,
do
I've,
you?
I've watched Dr. Vidali's stuff on his mapping. It's very interesting. We do not offer that. But should we?
Hmm.
I mean, it's just again, like it's a new thing. I mean, it's not even that new, right? Like you said, like it's like we should be
Yeah. Mhm.
doing this type of mapping. And
Mhm.
um I just it's always about like,
Mhm.
where am I gonna spend my time today?
Right.
I have like, you know, these four surgeries, this list of connect patients, like today I'm off, I have to get my
Mhm.
kids, like, you know, so I want to learn that. I want to learn the mapping. And I think that that's the
Mhm.
best, most safest way to
Mhm.
go in surgically.
Yeah.
Um, but yeah, I do what I can to kind of know the
Mhm.
disease and read operative reports and, you know, imaging and all of that and kind of know the things. But the mapping is definitely an amazing tool and an
There,
area where I feel like I need to learn.
there is this conference happening. I think specialist chef, forgotten her name, in Mayo Clinic, Arizona, is leading the movement in the U.S. and she's heavy on endometriosis mapping and everything
Okay.
endometriosis. um, the way that I found that this can work, if you can network with one of your abdominal radiologists in your center, encourage that person because also radiologists
Yeah, you need your
want,
colleagues.
yeah, so they can go learn from them, and then they want to be also more niche and subspecialized. That's something that I've learned about radiologists. My wife is in neuroradiology, and I've
Okay.
spoken with one of her colleagues. He wants to do it, so maybe
Interesting.
that could be a good addition to your practice and also for that person because now that person will become the pioneer in the States in some sense. Everyone will send their images to her or him.
I don't have, I mean, we're just trying to get like the the ultrasound technique that we need from our sonographers, right? For
Hmm.
endo. And so I would love to like have a radiologist who's dedicated at
Hmm.
helping with this. That's on my list of my long list of requests, prayer
That's
requests.
the most common thing that I've learned about endometriosis expert is there be the one of the most time consuming thing in their life in the first decade is going to be team building.
Yeah.
You have to build it, but there's no way to not build it. But also, it's so difficult because it's so difficult to sell the idea to people,
Oh yeah.
right?
Wait, what is this? Like,
Right?
yeah. So I think that's a really, really interesting thing that you said. And so, you know, the funny thing is that I try to like,
Mhm.
I for a long time was like, I just want to
Mhm.
go to work. do my job, take the best care of patients as possible, and then like I need to go home and take care of my kids. And I work part-time. So like I really am like pretty firm on my box of boundaries. And when I'm not working, like I have people who can cover me. Now, certainly when something happens, I do come in. But I've been very firm on that. And so I felt like I might have isolated myself, a little bit from like we have a great like OBGYN team, but like in terms of like knowing our general surgeons really well, knowing our urologists really well, knowing our imaging people really well. Like I feel like I had to focus so much on my family and the last 10 years that I really like had to put my career second. And this is another thing that I've been kind of battling with. It's like, okay, just leave it all behind and just be a stay-at-home mom and, do my own thing, be an influencer. I don't know. So I do think you need to have some skin in the game to be able to do what I'm doing. At the same time, like, I think that team building is going to be really crucial for me in the next, at least in the next year for sure. And then in talking with people who work outside of the organization who have other setups, like the team is the most important, and having people who are like, okay, pelvic pain, endometriosis, we're all kind of focused on the same things is what makes other positions potentially more attractive around the country, because in a lot of other in a lot of other areas, the team has been built. You're just joining it. So yes, team building is ultra important in endometriosis care and management for sure.
And thank you for sharing that aspect of the family and being a human and also being a doctor. Because, a lot of times I understand, everyone understands the anger and the frustration in the community. But then taking it on a doctor, they have their own chronic conditions. You shared it here. Yeah, they have the family. It's in some sense I've been targeted to some of those attacks. So full disclosure, I think, and I felt really frustrated and vulnerable, and I felt like it's unfair to me what I've done that hurts you. I'm trying to do some good thing here, but so I think then attacking them, it's unfair. It's a human being. They have limited time with their family. They have to take care of their family. So thank you so much for sharing that. That was very important.
Yeah. So, and I mean, it's this, I do feel like some people are like, well, the robot's just gonna like in the future, we're just gonna have AI and robots taking care of all these endometriosis people. And I'm like, okay, great. That sounds good. I will assist for the robot because it is a hard thing for humans to take care of other humans. It's very imperfect. And as a perfectionist, this is an almost impossible daily struggle for me.
Mm,
Um, so yes, I'm learning to have grace for myself and those around me, and also for my patients.
mm.
And I don't know. It's just I don't. We have humans taking care of humans.
That's
So I don't know.
amazing.
Maybe AI robots would be better to take care of humans. It remains to be seen, but I'll take whatever help I can get. Like, robots are going to take over our job. Great. That sounds good. If they can do it better than me, fine.
Good, but also add good luck with that, because there's a whole philosophy going. But I know what you say. My wife has similar frustrations. Like, I think every humans, especially um, you know if you have family, children, then you have a lot of responsibility. Then it becomes a competing interest, like your time for your family. So I
Right. And
understand.
then they have health issues. And it's like,
Yeah.
I mean, at least in the dynamic of my family, like, especially with children who have health issues, I feel like they really need an advocate. Right. And so, my daughter has a heart thing that's going on right now. She's a new heart thing. And so I love my husband, and he's very good, but he's also very trusting of doctors. And I am too, but I'm also like, this is what I need. She needs to see this person at this location. This, I know what we need to do, right? Same thing like with my son who has ADHD. Like, no, no, no. He needs to see this person, and this is what we're going to do, and this is how it's going to go. So, I mean, it's a little bit of a personality thing, but my husband has health issues, and everyone does, right? And he went through a crisis with his health. He got a C. diff infection a couple years ago, and it was missed. by so many people. And finally I was like, I think you're dying of C. diff. And so it was during COVID, which is unfortunate because they didn't let a lot of us in there, right? And it is a very complicated story, but I literally was like walking into this institution and it wasn't Kaiser. And I was like, I know I can't be back here, but I instead wrote on the whiteboard, I think my husband has C. diff and he's dying. And they were like, no, I think we'll just give him antibiotics. Lo and behold, the next day he became septic and almost died. But I tell you, he was like, well, I know, but I just trusted the doctor. I'm like, don't trust anyone. I hate to say that, but it's like, I can't. That's why I feel very strong in my personal life with my kids and like their personal health struggles that I have to be like, I have to be there for them. So I feel like this enormous pressure to be that because at least in my family dynamic, I don't feel like people sometimes you just can't advocate for yourself, you know? So I feel like I have to be like, no, don't run a pregnancy test on my husband. He has C. diff. He's going to die. Here's what you need to do. So, yes, true story. Went to the ER. That's what I wrote on the board. And I ran a pregnancy test on him and sent him home with antibiotics.
Wow. Thanks for sharing. Yeah.
Yeah.
So, I mean, we are
On a
getting
tangent.
to, yeah, this is a great conversation. You have so much energy. I wasn't mistaken. I knew you have a lot of energy based on your videos. But so, I think you love hot spaces, right? Because I read that you love hot yoga, and also I saw
Yes.
some of your videos in sauna.
Yes.
Are you escaping from the cold? Like, what's
I
going
don't,
on?
I have just always loved hot. Like I went to college in Arizona and I remember like I used to love running. I don't run anymore, but I used to love running in the summer at like noon. So I would like go for a run in Arizona. So I don't know. Right. And I love hot yoga. I don't have like, I don't sweat a lot at baseline. So like when I find activities and situations where I can actually sweat a lot and get that out there, it helps. But it has to be like, okay, we're sitting in a sauna. Okay, we're doing
Mhm.
yoga in over 100-degree heat. Okay, we're running in the middle of summer in Arizona at noon. So I don't know. I've just always been drawn to that. But I'll tell you, like when I sleep, I have to be so cold, like so cold, like in a freezer. Like I'm not yet, I'm perimenopausal, but I'm not menopausal. And I have been sleeping in menopausal sheets, my poor husband, forever because I'm like, no, we need to be like, it's like a meat locker in here. So I must have some temperature issues
Yeah, right.
myself. I have normal thyroid function, but definitely some temperature stuff. But yes, I actually did my 1000th class yesterday. I did 1,000
Wow.
classes yesterday of yoga. Yeah. They're like, yeah, I was like, great. I should be some like master yogi, but I'm not.
Right. Why? Maybe you don't call yourself. You are in reality.
No, I grew up dancing. I was a dancer. So I just feel like it's like a natural
Mhm. Mhm.
thing.
So, what are the exercises that you like? Yoga and dancing?
Um, so I mean, besides doing TikTok dances with my daughter, I don't do a ton of dancing. I mean, my daughter dances competitively, so sometimes I have to learn her dances to be able to teach them to her, and then she'll be like, "You're not doing it right." And she always wants to do some stupid TikTok dance. So I'm trying to turn it into some type of educational information about
Mhm.
endometriosis, and she'll be like, "That's stupid. That's really dumb." But yeah, I would say I try to go to hot yoga, once a week. Some weeks I get to go 4 times a week. That's a great week. But that's really, I've been going to this kind of the same place for the last 10 years. And so I kind of know the instructors and the people in
Mhm.
the community. And actually, a lot of my
Mhm.
patients go there. And so I gotta get to see them too. Um, and so it just feels like a really strong community at the yoga
Mhm.
place that I go to. And it feels like, kind of like that stupid cheers thing, like everybody knows your name.
Mhm.
So, you know, I really love that space. And so it's not only community, but that's mostly what I do for exercise. And, I've been struggling personally recently. And so I just try to actually just walk our dog outside in the sunshine, and it's good for the whole family. Like everyone, we're going on a walk. We're all going. Everybody, I don't care how cold it is, we're going for a walk. And then we're like, it's freezing. So cold.
I like how pushy you are in making people to do good things.
No, yeah, no. You tell my husband that. Yeah. And my family.
He's gonna hate me probably
Yeah.
for encouraging you to do that.
Yep. It's like, I have enough to do with her. She has a
And
life in her hands.
and do you follow any sport professionally, like any professional sport? I mean,
You know what? I don't really watch TV.
mm,
Um, and I don't have a good answer for you on that one. Why? I think I have this nature to like binge stuff, right? So if like my husband's like, you should watch White Lotus, and we actually went to Sicily, like, and stayed at the place where White Lotus was filmed, and like he tries to like get me into it, and I'm like, okay, now I feel like I have to watch the entire season
wow.
in one sitting, and I have to go to work tomorrow. So I get like it's the same thing with like books. Like I read a book and I'm like, I need to finish this entire book tonight. Now I can easily put that one down and fall asleep. But with shows and TV and like games and stuff, I'm a little bit bingy when it comes to shows. So I mean, I don't follow professional sport. I mean, I'm like Packers fan, but only when they're winning.
Mm,
And I'm not a huge Broncos fan. Now my husband is like a diehard Yankees fan,
wow.
New York Yankees, and so is now my 8-year-old son. So I feel like I have to like as soon as the season starts here, I'm gonna be like we watch it like every day. So I feel like now I'm watching the Yankees all the time. Um, that's the only sport that I follow, but it's not voluntary. It's kind of
Mm,
involuntary. And baseball,
okay.
they're playing every day. Like they play baseball like every day.
Wow.
There's a game. Like, why are there so many games?
Right? I don't know how they can
I
keep
don't
up.
either. Oh, like they were on yesterday. Like, oh no, this is like a 4 game series. Oh, they're traveling. Okay, tomorrow they're playing again. I'm like,
This is
hey,
wow. It tells a lot about you. Like, I mean, when you say you binge things and like you finish the book, you have to. I mean, it's probably a combination of your perfectionism and also your strong stamina to push things forward. I think you can't stop things when you are in the mood.
yeah. Unless someone is like physically restraining me.
Which is impossible unless no, no, you commit some crime or something. But it's hard to physically strain you now, especially you're active dancing. I mean, probably you have a lot of strength in your muscles. So
Yeah.
let's see. That's pretty cool. Thank you so much. I
You're
really
welcome.
appreciate your time. Is there any last word you want to say here? I
No, I
didn't
think you're
ask.
doing a really great job. And I'm trying to like send as many people because that's the thing. I get the most common DMs, messages on and on my comments. Where can I see you? When can I have an appointment? And then people were like, request appointments. I mean, like, I don't have any appointments. Um, and it's probably something I need to fix on my Instagram. But
Mhm.
I I just try to send people in that direction and this resource. And there's other resources, that have been out there that are kind of a lot of drama in the endometriosis community. So I feel like this is like you have like a good non-bias like
Mhm.
base. And I like how you're like, okay, we have pelvic floor PTs, like all the different things. Like it's
Mhm.
not just a lot, some excision, but like also the other things too, and how you're trying to vet all of those. So I appreciate the work you're doing. I'm just like, it's definitely needed. I have definitely thought a number of times where I've gotten those messages. I'm like, I just need to like make my own resource out there for people. Like, here's who to
Mhm.
see, here's who to do. But you're doing a great job. So we don't need to be doing that, Jill. You have enough to do. So
Thank
keep
you.
up the good work because I just send people your way.
Thank you so much. I'm hoping that we will meet your expectations and your patients' expectations. Hopefully, we build this to become a referral source for
Yeah.
doctors.
I
And
get this question. I just am like, how do people not know about this resource? So, anyways, I'm getting it out there. I might type that might be the most common thing I type every single day on Instagram and TikTok. You need to reach out to I Care Better. Take a look at this
thank
resource. So
thank you so much. I really appreciate that.